All right, so in the previous video, we saw some of the posterior muscles on for the posterior arm and the posterior scapula. And there were some muscles that I mentioned that we can only see from the anterior aspect of the scapula, specifically one of the four rotator cuff muscles that you cannot see from the posterior side. You can only see it from the anterior side. So we're going to talk about that one, and then just one other muscle that also started on the posterior aspect of the scapula, but then ran anteriorly to attach on the anterior aspect of the humerus. So right now we're looking at an anterior view of the scapula and the humerus. If you need to look at the bony landmarks, you need to go back to the first video of this series of the anterior arm, and it'll go through all the bony landmarks of this view of both the scapula, the humerus, and the proximal radius and ulna. For now, for this one, this is going to be a short video. We're just going to talk about two muscles that are related to the posterior scapula and humerus, but can best be viewed from the anterior side. So Teres Major starts attaching to the inferior angle of the scapula, but on the posterior side. Okay, so we can't see that from this view. That's why there's a curved arrow over here delineating the fact that it's attaching on the posterior aspect of that scapula. From there, it runs anteriorly to then insert right here on the intertubercular groove. Remember that the intertubercular groove means that it is between tubercles. So it's between the greater tubercle, the lesser tubercle, which is here, and the greater tubercle, which is out here more laterally. And remember that the intertubercular groove is also known as the bicipital groove because the long head of the biceps tendon runs through there to then attach onto the supraglenoid tubercle of the scapula. So saying that it's the medial lip is a very specific way of saying that. Some curriculums may or may not demand you to know this level of detail, but I'm putting the medial lip there because you're going to see later that we're going to see muscles that don't attach to the medial lip, they attach to the lateral lip. But anyway, for all intents and purposes, Teres Major is going to attach from there to there, and it's going to look like this. All right, it's going to look like that. And like we said before, it's going to assist in adduction of the humerus. So it's going to pull the humerus back towards the body. And it is also going to be able to produce an amount of internal or medial rotation of this humerus. Okay. Next one, subscapularis. Subscapularis is the fourth rotator cuff muscle. In the previous video on the posterior arm, we talked about the other three. In this one, we're talking about the last one, the fourth one. Subscapularis. Subscapularis is going to lie in the subscapular fossa right here. And then from the subscapular fossa, it is going to course right over here to insert onto the lesser tubercle of the humerus. So based on that, we can see how the way that this muscle is oriented in relation to the shoulder joint is that it runs anterior to the shoulder joint. It will grab on this lesser tubercle and pull it this way to effectively rotate the humerus internally or rotate the humerus medially. So with that, you can see how the rotator cuff muscles as a group, as the four of them, will cause either internal rotation, external rotation, or abduction of the humerus. Okay? And that's it for this video. Gross anatomy is one of the most difficult subjects in the world. Luckily, it doesn't have to be. Anatomy is one of those subjects that needs constant verbal and visual repetition in order to get good at. What better way to reinforce this information than with the scientifically validated method of drawing? Neuroscience has shown us that we retain information better when we physically draw it out. That is why the Gross Anatomy Study Strategy Workbook is designed to walk you through all the layers of the musculoskeletal system, allowing you to draw the muscles into place. This is excellent for reinforcing muscle attachments, bony landmarks, muscle names, and actions. This will save you tons of time from mind-numbing tactics such as repetitive flashcards or passively listening to boring lectures. With this strategy, you can actually begin to enjoy studying again and have a much better way to retrieve the information. Order a copy of the Gross Anatomy Study Strategy today at the link below so you can spend less time being stressed and more time being blessed.